Hi, Andy Culkin here again, author of Amanda, A Cautionary Tale. It's the story of my wife's 20-year decline with alcoholism and ultimately her untimely death a little over 2 years ago. Today I really want to talk about the relevance of alcoholism and how it permeates our society, directly related to COVID-19, and how it's really a tertiary pandemic because of COVID-19. Now, to begin with, I really want to talk about the internet for a second, because I'm glad we have a venue that we can talk about things like mental health and drug abuse and alcoholism, where 20, 30, 40, 50 years ago, the way people dealt with these issues and families dealt with these issues is they didn't talk about them at all, and they just squashed them, which did nothing but make the matter worse. So at least we have venues where we can talk about these things, discuss them, expose some truths, and we have the ability to share ideas and really create a different stigma to mental health issues. There was always such a stigma of mental health issues. Like, oh, if someone in my family has a mental health issue, we shouldn't talk about it. Nothing could be further from the truth. We need to learn from this. So as I get on that subject, these are 5 reasons alcoholism and related mental health issues are more relevant than ever, directly related to COVID-19, which is the real pandemic. And the real pandemic is the mental health fallout from COVID-19. First thing is alcoholism is on the climb, and it is directly related to the COVID-19 pandemic. According to national surveys, there has been a 21% increase in excessive binge drinking. What's excessive binge drinking? People that drink 2 or 3, drinks a night are drinking 8 and 10. And they're becoming chronic, quicker, faster, and with more fury and force than ever, because a lot of people have lost their jobs and their livelihood, and the stress within families, and being confined in spaces. This has all created just a massive increase in the consumption of drugs and alcohol, and has created depression and a plethora of other mental health issues. Now, this increase will likely result in an increase of between 19 and 35% mortality rate increase, all directly related to COVID-19. Subsequently, deaths directly related to alcoholism will increase annually from an average of about 100,000 annually, which is average for the last 20 years. And this is going to increase from between 120,000 to 135,000 annually. So on average, just the length of the COVID-19 pandemic for the last 2.5 years, we've had an increase of almost 100,000 people dying of alcoholism, greater than the norm. Okay, that's a lot of people. That's not even the people who are suffering who haven't died yet. It's growing exponentially. Thus, the relevance of this book and the conversation that we need to create. The second reason is for the dramatic increase in alcohol consumption directly related to COVID-19 are as follows. Increases are due to the shutdown, stress-related issues, 47.7%. Because people have lost their jobs, they've lost their businesses. We know what's going on with that. There's also a 34.4% increase in alcohol availability. Liquor stores were one of the things that were deemed vital enough to remain open during the pandemic. And luckily, the powers that be understood that, because if you didn't leave the liquor stores open, people probably would have broken the windows down anyways, because you can't take everything away from people. But like anything, we have to understand moderation, and I hope A healthy person understands that. Everything's okay in moderation. It's when we have excessive binge drinking is where we all run into major problems. Boredom is part of the problem. 30% increase. People drink because they're bored. They don't know what to do with themselves during the day. They can't go to work. People who have had their livelihoods and businesses shut down now found themselves with nothing but time. Let's go drinking. Let's take drugs. That's just the way the mind works, I suppose. With no place to go and nothing much to do, and an increase in stressful life situations, alcohol became the natural vice to fall back on. 3, quite simply, social isolation, added stress, and boredom directly related to COVID-19 has created a serious health situation in the U.S. The indirect effects of COVID-19 are equally disturbing, and a lot of this is just facts and figures, but there will be an additional 18,700 cases of liver failure, a 20% increase in liver cancer over the next 2 years. So, I mean, the health issues are just exponential because of COVID-19. Additional long-term effects of the increased consumption of alcohol include high blood pressure, heart disease, stroke, digestive problems, brain-related conditions such as dementia, cirrhosis of the liver, which is a natural reoccurring problem for anybody who's a chronic alcoholic. Amanda certainly suffered from that. Reduced sperm count. We can actually affect, how much the population, the human population will be affected by this. There will actually be a decrease in babies because of COVID-19, which is crazy. And testosterone levels in men and women, and an increase in breast cancer for women, directly related to alcohol consumption. These are all health issues, serious health issues, because of excessive alcoholism. Other common negative attributes that COVID-19 affected is our mental health. Okay, the negative effects of quarantine includes stress symptoms similar to PTSD, post-traumatic stress syndrome. Confusion and anger lead to vices such as excessive drinking to susceptible segments of the population. Other concerns such as infection, fears, boredom, inadequate supplies, inadequate information, inadequate supplies. I mean, think about the rush for toilet paper. I mean, who understood that? And the fear and the unnatural phobia over, not being able to get toilet paper or water or what's the latest one? Baby food. And the fear that this is all created. It creates a lot of stress, which directly creates drug addiction and alcoholism. Stress is the number one. What other things? Other concerns such as inadequate information, not knowing what's really going on, financial loss, obviously, the stigma of actually being tested positive for COVID-19 that can all lead to mental health issues, and it can exasperate vulnerable persons who are already struggling with mental health issues. If you got somebody who's already kind of borderline depressed and they get COVID-19, they're going to jump off the cliff. I mean, they're going to fall off the cliff. And these are all problems because of COVID-19. Fifth one, the other mental health issues related to COVID-19 could potentially develop into alcoholic tendencies are obviously depression, pre-existing mental health conditions, neurological conditions such as delirium, agitation, and stroke. High blood pressure creates stroke. Stress, certainly alcoholism creates high blood pressure, which can lead to stroke, and other related mental, dementia, other related mental health issues 10, 20 years down the road. Nothing good comes from excessive alcohol consumption. There's also been a 32.8% increase in depression rates, which now affects 1 in every 3 American adults. That's 100 million people in this. That's over 100 million people in this country. Let's talk about this for a second. 32.8% increase in depression. Boy, I wish I had stock in a Valium company prescription benefit. Oh my God. I mean, the thing is, doctors prescribe that. But the real prescription is that we need to have happier lives. That's the real prescription. You're never going to find it in the bottom of a pill box. You're never going to find your solution in a pill box. Whew. Suicide rates have also increased in certain age groups during the time of COVID-19. The age group between 15 and 34 have seen an increase of 2%. An increase of 2% of suicide directly related to COVID-19. And most of that is really because of alcoholism. It's certainly related to it. Equally alarming is that 4 in 10 adults have reported symptoms of anxiety and depression compared to 1 in 10 adults prior to February of 2020. That's a 30% increase directly related to COVID-19. And all of these figures go directly to alcoholism, drug abuse, and mental health issues. This is one of the reasons why I'm on this campaign. Okay, it's the reason why I've written this book, is to have a conversation. Because if we don't have a conversation, this problem is only going to increase and get worse, and we need to find ways to combat it. Because I don't want people to go through what my family had to go through. It's that simple. And I have a lot of experience and a lot of education. And my experience with Amanda, her life and her death, I wouldn't wish upon anybody. So if we can prevent that, that's my goal. Thanks for listening, and we'll talk to you again soon. Thanks.